Hey everyone, it's Nomi. This is a 2 year update. It's actually about 2 years and a month since the surgery that I had. And people have been asking about the cyst that I mentioned in the last update in February and various things. So here it is. Um, I've actually been doing really well. I did not go back to the surgeon after I got that analysis of the MRI because I was just feeling much better. So I didn't see any reason to go back. If it starts playing up again or worsens significantly, I will obviously go back. But basically, in the last 6 months, things have been going well. For a few months, I kind of stopped going to the EMS training because I started a new job, and in the new job, I am working 12-hour days and running around a lot of the time. So, A, I was getting a lot of exercise, and B, I simply did not have the time to drive half an hour to the workout and back. In the last month, I have started going back once a week. And it's wonderful. I really highly recommend EMS training for someone who's gone through the spinal fusion because I'm not allowed to do weights ever again, apparently. And I really enjoyed the feeling of really manipulating various muscles and really feeling your body work. And I just wasn't getting that experience doing just aerobics. So with the EMS, it's 20 minutes of intensive workout, and you're not actually using any weights, but you really feel that same, tension in the muscles that you feel when you are doing weights. And my body is definitely, showing the results. It's tighter, it's stronger, and I'm happy to say that not just due to the EMS, because I wasn't really losing weight due to just that. I was starting to look better, but I have been much more careful about what I've been eating lately, and I have lost 7 kilo over the last 2 months, 2.5 months or so, so I'm very happy about that. That's just over a stone for the Brits among you. So that's great. I'm feeling good. I'm feeling more confident. I've dropped almost 2 dress sizes. So I think together with the EMS and the diet, it really has helped get my body. It's not quite back to where it was before my back worsened, but it is on its way. I have about another 5-6 kilo to lose until I'll be sort of back where I was before my back worsened. So that's my goal. But I'm already feeling a lot better. And regarding my back, it's really doing great. I mean, the last 2 weeks or so, I'm studying for an exam. So I've been sitting a lot, just studying. And that's not great for my back. It's not in terrible agony. I haven't been taking any back pain medications, but I do get sciatica sometimes, and I think it's just because I'm not active enough right now. The sitting around is really not great for the back. So it's, I know, I'm pretty sure it's just due to the sitting around, and my exam is in a week, and then I will be running around again and resuming my EMS training once a week. So I think that it will improve. Um, Other than that, I recently went with 2 of my kids to Amsterdam for 5 nights. We stayed in an amazing Airbnb, which was a houseboat, so highly recommend that. It was fantastic. The reason I'm mentioning it is because A, the flights were fine, and B, 2 years after the surgery, I'm very happy to say that I'm totally able to be very, very active. We walked miles. I mean, one day we walked 12 kilometers, another day we walked 11 kilometers, one day we cycled for 6 hours straight, and my back was fine. So I'm really, really happy about that. Um, no, I mean, obviously in Amsterdam, it is not hilly. So I don't know how it would have been had they been, walking up and down hills the whole time. But being active all day for 5 days straight, very active, I felt great. It didn't hurt me. My back didn't ache. So I'm really, really happy about that. And in 2 weeks, I'm flying to Austria with my husband. So then we'll put it to the test if I also feel good hiking up and down mountains and cycling in a hilly area. I'm not going to ski. I mean, it will be August, but apparently there's a glacier there that sometimes does have snow. I know that I'm not allowed to ski, and unfortunately, it's something I've never done, and I never probably will do because it could be very dangerous for my back, and I'm not gonna risk it. However, hiking in the mountains and cycling in the mountains sounds amazing. So we're going to be spending just over half the time in Vienna, just walking around, seeing Vienna, and then 3 days in the Austrian Alps. So I'm looking forward to that. I will let you know how my back takes to all of that strenuous activity. I think it will be okay based on what's happened until now. And to the sex, no change really. It's good. I can do practically everything. Still on top for me, me on top is I haven't really been trying it, to be honest, because we have good sex without it, and that movement of my hips it does tend to make my back really ache. So I've been avoiding that position, but with him behind, being as passionate and effusive as he feels like, I seem to be able to take quite a lot of beating. I mean, not real beating, but that kind of beating. So no pain afterwards. Definitely carefree, enjoying it. So that's great. Anything else? Yeah, I had a specific question about the cyst, but as I said, I really haven't been back to the surgeon, so I don't know how it is. It's possible that this sitting around that I'm doing now, studying, it's possible that the pain that I'm experiencing, the sciatica, is due to that cyst, but if it worsens, if it really, I really do feel like I have to start taking pain medication again, I'll go back to the surgeon, but for the meantime, I feel pretty good. Even though I have the sciatica sometimes, it's not debilitating, it's not severe enough to need to warrant taking any medication, so that's fine. So I will probably speak to you again after my hiking and activities in the Alps, because that I think will be the most strenuous activity I will have done since the surgery. I think at some point I might also just give a slight recap video for people who don't want to try and find out, going through each one, exactly when you can start having carefree sex. I honestly don't even remember myself at this point. I'll have to watch them. I think I might just give one recap video about that. But that's it for the meantime. I hope you're all feeling well, and I will speak to you soon. All the best.